Good morning, everybody. Welcome to our March Los Angeles Veterans Collaborative. Incredibly happy to be here. It is National Women's History Month. So we have a lot of amazing things that our women have done. We just want to give some recognition to some of the women who are here, either in the capacity of being a co-chair, being one of the members who are kind of facilitating in the background, finding our speakers, doing the technicals, our families, everyone who's participating in our collaborative. We have about 200,000 women serving on active duty status in the US military. California is actually home to nearly 163,000 women who have served in the US military. So here in our collaborative, we have veterans, family members, friends, business owners, professionals, community leaders, and advocates. So we want to make sure that we take that time to understand women in all their different capacities and how they're helping this specific community. And we want to say thank you to all women for being here and being part of this group. So thank you so much. So with that, I want to go ahead and introduce Miss Christina Garcia, who's going to be giving us updates on the VPAN.
Hello, everyone. Good morning. Here we are, March, LAVC time. Thanks, Amy. That was a great slide, by the way. I saw a lot of community leaders in there that I know. So I'm looking forward to meeting the rest of them very soon here. All right, so here we go. Let me share my screen here. All right, so I'm going to start out with, I'm Christina Garcia, and there is a little story that I'd like to share with you guys. And the story kind of brings me full circle to where we're at right now in this capacity. So when I was on active duty last year, I was the company first sergeant for recruiting and retention battalion in Azusa. And we had a soldier. And this soldier, all the supervisors, all the leaders, all the soldiers, they were like, oh, he's a dirt bag. He's this, he's never on time for formations, all that negative talk. I come in as a new first sergeant and, I'm the one to give the benefit of the doubt. Let's see what this soldier's about. So got to know the soldier, didn't show up for formation still. I had to write him up a couple times. After the second time, I'm like, wait a minute, there's something else going on here. So brought him in, came about, he was going through a divorce. His father had just passed away. He was going through some PTSD situations. So we were able to guide him into the right track, but leads me to this point to where we're at today with VPAN, right? The Veteran Peer Access Network. We're here to provide that comfort, that safety, that security for those veterans and military family members that have been lost, that don't know the way, that need the help. We're the ones that are here to help. So, if I wasn't there at that time with my commander who had the confidence to say, all right, First Sergeant, you think this is the right thing to do? Yes, ma'am. So, we took it and we handled it and we were able to rehabilitate the soldier. Hence here, we will rehabilitate those that are in need. One veteran, one military family member at a time. All right, so with that being said, we have some stats here that I'd like to share with the group. So we did do a soft launch on 7th of January of this year. We did start the contracts back in October. However, it takes some time to get the program started, to get the wheels in motion, to get the peers trained. So as far as right now, today, well, as of 28 February, the top service type requests are employment, housing and shelter, income support, and benefits navigation. And this is just the data that we've pulled from 7 January to 28 February. So, with that being said, those are the top areas, but there are other areas that we are assisting veterans and family members with. We've provided support to 154 clients so far. The breakdown is 39 Army, 8 Air Force, 20 Marine Corps, 34 Navy, and we have 53 that are not disclosed, and many different reasons. Everybody has different perspectives of service and when they did or how they served. So, so those are the current stats as of now. We should have some of the program managers, if not all, on call today. And these program managers, they were selected for several reasons. The biggest being that they are driven, passionate in helping veterans and military family members. They are team leaders. They are a force to be reckoned with. And once you meet them, you'll understand what I'm saying. For JVS SD1, we have Adam Castillo. For VOA SD2, we have Ms. Christina Reingold. And for Goodwill SD3, we have Terrence Mann. US Vets SD4, we have Brandon Washington, who just started, so he's getting his feet wet this week. For JVS SoCal SD5, we have Jimmy Guevara. So with that, you know, I'd like to say that we have over 355 years of serving communities in LA County. What do I mean by that? Well, each of these organizations have been in existence for many years. I'll give you some numbers here. So JVS was founded in 1938, that's 83 years. VOA-LA was founded in 1896. Goodwill was founded in 1902, and US Vets inception was 1993. So, you know, just to give you a little understanding of our organizations selected to be community-based organizations. Currently, we're at 88% actually. We were able to retain one of our battle buddies. However, we are still hiring a couple battle buddies for VOA-LA, SD2, and a squad leader for Goodwill, SD3. We are hiring one squad leader for US Vets SD4 and one battle buddy for also US Vets SD4. So if you know of anyone who is interested in a position, looking for, you know, providing support in Los Angeles County to our veterans and their families, please have them contact myself or Jim on the DMH side of the house so we can take care of them as well. We do have rally points, and for those of you that don't know what rally points are, they are basically hubs that will be available for any veteran and their family to come in, and similar to a USO where they come in and just relax and lounge and chat with other veterans and families, and, you know, just have that sense of camaraderie. And, you know, those will be in different areas of LA County, depending on the supervisory district. So as you know, we do have veteran service teams in each supervisory district. So for Supervisory District 1, which is JVS, they'll be located in El Monte. So that'll be the rally point, and we will have our veteran service team members there, and they'll have, you know, scheduled days that they will be there. So it's important, you know, just to get familiar with those rally points so that way you can advertise them in the local communities. For SD2, which is VOA-LA, they'll be located in Compton. For SD3 Goodwill, we don't have a location pinpointed yet, but we are searching. So more to follow on that one. For SD4 US Vets, we have Long Beach identified for them. And lastly, for SD5 JVS, we have Lancaster. Yes, Lancaster. I said it correctly. Currently, we have Unitas as our technology platform, which makes it a lot easier for us to refer any clients and family member. But not only do we refer through the system, we also do a warm handoff, which means what? Well, that means that we don't just tell you, call the 1-800 number, fella. Go and get on the website. We actually make sure that that connection is made, that it's human, that we're reaching out to the veteran or family member to make sure that they feel that rapport, that we're not just some automated robotic system that is going to send you somewhere and you're not going to get the help. Because a lot of times, you know, this is the last resort for many. So we never want to turn anybody away. We never want to say, oh, you don't qualify. We want to provide as low barriers as possible with VPAN. So currently we have 37 organizations. That's veteran service organizations across LA County. So we want to increase that dramatically in the next few months, and we need your help. So everybody on call knows somebody, knows 3 people. So reach out to them, would you, for me? Reach out and tell them about VPAN, tell them how we are that organization that is filling the void in the county for veterans and family members. I mean, if it hasn't been us that has been touched by the void, we know somebody that has been left out in the cold, left out from the benefit. You know, I still know veterans that are like, wait, what? You're getting paid for your compensation? And yes, you are. So yeah. So anyway, tag a friend. Let us know if anybody's interested that they can come and see us. Amy, are you still there? Because now I'm going to pass it on to Lavelle.
The Los Angeles Veterans Collaborative for allowing me to come and share with this awesome work that you do that I'm so impressed with today. And I think I just want to share today real shortly about the challenge of military families. I think people join the military basically for about 10 reasons. 1, to serve country. 2, second, to travel the world. 3, to stop terrorism. 4, college education and benefits. 5, get good paying job. 6, duty and honor for country. 7, family tradition. 8, learn new skills. And 9, get a career. And 10, people join the military to turn their lives around. As you can see, very few people join the military for patriotic reasons. I'm sure we are very patriotic about the military, but I believe most people enlist in the military are the 7 branches of the military to fulfill their dreams, goals, and career opportunities. Joining the military is an opportunity to develop and exercise, your God or our God's given skills. The United States military is an institution of hope, liberation, and a lifestyle change for families and communities, not just in Los Angeles, not in just the state of California, and not just in our country, but around the world, I believe. And so is the case with me in my life. I grew up in St. Louis, Missouri. My mom had 10 children. There are 9 boys and 1 girl in my household. And I'm the 6th child of those 10 children. 6 of my family members enlisted in the military. 2 of my brothers were in the Marines. My oldest brother was in Special Forces in the Marines. 2 brothers in the Navy, and 1 brother and myself in the Army. When I entered the Army in basic training at Fort Leonard Wood in St. Louis, I entered as an E3. Over half of my family served in the United States military. I joined the Army at age 19. Additionally, or initially, I tried to join the Marines because I wanted to play in the president's band. For some reason, I think I was probably too small, but the recruiter, some kind of way, got me in the Army. And I was a musician, and I felt that joining the military would provide that, an opportunity to play in the military band. I'm a drummer. It was also a chance for me to escape the very impoverished circumstances in St. Louis. But the emotional, let me say again, the emotional and psychological challenge for a youth growing up in a single parent home was quite overwhelming, the emotional and psychological impact. But the military life cannot shield families today from the devastating impact of COVID-19. The coronavirus invaded our American shores a little over a year ago as of this month. The virus attacked us by air with very little warning. We have suffered over 500,000 civilian and non-civilian casualties. COVID-19 is our kids' 21st century World War I and World War II. It's our kids' Hiroshima or Vietnam. Coronavirus is our children's mental and emotional Holocaust. Just think about that. Think about the Holocaust that did take place in the 20th century, in the early part of the 20th century. But for our kids, particularly our kids, veterans, our children of veterans and children in the military and serving in our armed services, for them, it's one thing to be impacted by this in civilian life, but when we have to send our men and women to serve, and they have to serve with the stress of knowing that it's impacting our children, our military parents' children, that has to be overwhelming. It has to be challenging for soldiers to protect the most vulnerable when a soldier's own children and family members may or may not be protected. The suicide among military members have spiked as much as 20% during the COVID pandemic. That means over this last year, the suicide rate among military families, particularly youth, has climbed somewhere upward of 20%. Our military youth are suffering, a lot of them in silence. Most of our youth in civilian life and in military life are suffering in silence. And they're being severely threatened by the coronavirus. The first thing a doctor does when a patient goes to the doctor, he or she asks questions to determine an illness. Once the patient is diagnosed, medicine is generally prescribed. There today is a great urgency, as you know, in our country and around the world to vaccinate every person on the planet, in our state, in our country, in our communities. It's with great urgency that they acquire or they secure herd immunity, I believe. The vaccination goal is twofold, however. It's for prevention and salvation. They want to prevent people from catching or preserve them when they if they catch the virus, and they want to save lives when people actually contact coronavirus. There is an urgency also to attack our youth as well. The war on COVID-19 not only possesses a medical danger, but an emotional danger, particularly among our children. COVID-19, not only threatens us medically, economically, right? But it threatens our children emotionally and psychologically. Can you imagine if you and I were children today and we were told that we had to go home, graduating for the first time virtually, attending a funeral virtually for a child 19 or under, having to redirect psychologically and emotionally. And don't forget, let's not leave out that some of our children already have emotional and psychological challenges. Some of our kids already at home are already struggling with various emotional and probably exploitative circumstances. But to add on to that, the stress of the parents, to add on to that, the stress of military parents or veterans, because that's already a very stressful job. The mental and emotional vaccination I propose for the military today is an anthology I put together. It called Kids Journal Through COVID-19, United Kids Speak. Kids Journal Through COVID-19. It's a book that I put together in English and in Spanish. Kids Journal Through COVID-19. It's a novel that was created by 50 students, 50 kids that are part of our United States of America. 50 kids that represent every state in our union. And the book is written in English and in Spanish. A military anthology entitled Kids Journal Through COVID-19, United Kids Speak. I believe the military's family's best weapon in combating suicide, depression, anxiety, and youth exploitation is allowing children to express themselves. Let me say that again. I believe the best weapon for our kids to combat COVID-19 in the 21st century is that we allow kids to express themselves just like we do as adults when we go to the doctor's office and tell the doctor, give them our symptoms. I have a son, I have a young son who's 5 years old, believe it or not. And I watched Solomon. I watched him go through various changes. I watched him become quite confused and withdrawn. And it was when I sent him back to around other kids that he kind of went back to normal. You got to also realize I was one of those kids growing up in St. Louis that if they didn't bring food or lunch, or if there weren't programs like the ones that the Los Angeles Veterans Collaborative provide, those programs, I was a recipient of a lot of those programs. When I went home to fear. When I went to school, it was a joy, it was freedom, it was away from all the pain and agony and hurt. I can't imagine a soldier, a mother, a father leaving to go to serve our communities or to represent our country patriarchally or whatever the case may be, and have to worry about a child, a boy or a girl at home, not to mention if they're having emotional. You see, when I put together Kids Journal through COVID-19, United Kids Speak, I was told by most people that I shared this project what they said. One organization told me, I don't want to say their names, they said, you know, Mr. Bell, we didn't even think about the youth. If our military men and women are struggling with post-traumatic stress or PST or various anxieties, let's put it that way, I don't want to get caught on terminologies. Imagine what our kids are dealing with. Imagine if they already had underlying emotional and psychological problems. Military's family's best weapon in combating suicide, depression, anxiety, and youth exploitation is allowing children to express themselves. As a musician, when I was living in the projects in St. Louis, I attended the Performing Arts High School, and when I looked into the band room and saw kids that looked like me, when I say look like me, meaning my age, when I saw kids playing at a level, a very excellent level, they were playing symphonies and reading music, and they were kids black and white and from all backgrounds. That image in my head that I still have today, that gave me permission as a youth to say that I can play and be excellent as well. I believe kids speaking to other kids, kids expressing to other kids, kids talking about their issues. Because if our kids suffer in silence, we're in trouble. The military must utilize its arsenal of opportunity and arm every youth with hope and inspiration. You see, the worst thing that can happen to our military kids today is for them to lose hope, to lose their inspiration, so they can successfully work through their trauma and loss. We must act now. Kids Journal through COVID-19 is what I propose for a vaccination for every youth in the military. If we don't act now, we risk the mental and emotional health of an entire military generation. Think about that. If we allow our youth, particularly our youth in the military, our youth, our veterans, we allow those kids, this generation, this novel generation in 2020 and 2021 and probably going into 2022, if we allow this fraternity, this generation of Holocaust, emotional trauma to sit and suffer, we run the risk, as Christina gave those various statistics and shared earlier, about the impact of the emotional when they caught the person who had mental illnesses. Well, some of our kids already have some challenging circumstances. We run the risk of losing an entire generation. Kids Journal through COVID-19, United Kids Speak. It's written by kids, for kids. This is written by kids, for kids. 58 kids from Utah, Georgia, Alabama, Florida. Some of the kids are on Indian reservation. Some of the kids are black, white. Some of them have special needs. I want to end by reading, if I can, one story by Rahel in Washington, D.C. So every child in this book, we allow a child to represent every state in the United States. I'm going to read a story by Rahel. It says, a very important issue that is happening now in my life is COVID-19. I know this is a problem for most everyone, but the reason that it is so personal to me is that my mom works at a nursing home. She must keep working to support our family and to care for our patients. who need her attention, care for her patients who need her attention. Nursing homes cannot be shut down, and my mom cannot work from home, so she must keep working. Shortly after the outbreak, my mom became very worried. She was afraid that if she caught the coronavirus, she might pass it on to me and others, and then I might die. So she sent me to live with different relatives until life got back to normal. Now I miss her so much, and I feel so bad and helpless, even guilty that she cannot just leave her job for a while. At the same time, I'm proud of her for helping others. Everybody wants their old lives back when people could gather with family and strangers like without worry, when people did not die from this virus. Now it's hard for everybody. I'm especially sad that so many people are suffering and dying. Families are being broken apart. It's like a crack on a heart, and all the love is falling out. And while the world is trying to seal the crack, it cannot do so. Before this happened, I was focused on myself and pleased for having done well in elementary school. I have arrived in this country as a 2-year-old immigrant, and now I speak 3 languages and have earned a scholarship for next year. I'm also a proud American citizen, and so are many of my mom and uncles. Now that all seems selfish and unimportant to me, as I worry about my mom, I'm just a 5th grader who cannot leave the house. So what can I do to let others know that's important, or what's important in my life? Well, I'm writing about it, and that helps me to write about it. Also, I can provide she says I can provide emotional and support and appreciation to my mom. I do call her every night and tell her that I love her and that I'm proud of her. Maybe when this is over, my family and friends can organize, and even to thank healthcare workers who have worked so hard and sacrificed so much of these past weeks. Maybe as an adult, I could become a researcher and try to find cures. The outcome that I want is for the virus to be over and to have all of our family together and healthy. We all need to stay strong because all of us are in this crisis together, but we can't give up. If we all stay strong, we can seal that crack in our hearts and bring back joy. That was written by a 5th-year-old in Washington, D.C. And as you can see, she shared about the emotional and the spiritual impact that COVID-19 has. Her mother is a front-line worker, and military parents and families are on the front line. I propose that every youth, am I making a commercial? Yeah, this I propose is vaccination. I propose that we find some way to get Kids Journal through COVID-19, United Kids Speak, in every youth's hand. That's the least thing that we can do. You'll be surprised what something like this can do to inspire a military child, a veteran's child, or any child for that matter. But today we're particularly talking about military children. I don't want our military children to suffer. It's enough that their parents have to leave them, like yourselves, or veterans who've already served in the community. Kids Journal through COVID-19, again, is written in English and Spanish, and I propose that we get this book in every youth's hand, starting with California. Thank you very much.
Thank you, Lavelle. Everyone, that was Lavelle Bell speaking about speaking on the challenges of military children. He's a publisher and author of the Kids Journal through COVID-19, United Kids Speak. So thank you, Lavelle, so much for taking the time to talk to our families here.
Thank you.
Okay, so our next speaker, we have Mr. Anders Corey. He's the health deputy with the Office of Catherine Berger, and he'll speak on COVID vaccinations, as well as the access for non-healthcare veterans. Anders?
Is it working? Is that working?
Yes, we can hear you.
Perfect. A year into this, and I'm still always having trouble with audio and video on this thing. You think I'd be better at it by now. Thank you again, all, for having us. Again, my name is Anders Corey. I'm Supervisor Barger's health deputy overseeing all things COVID related. Also on here is Robert Alvarez, who handles military and veterans affairs for the supervisor. So he can kind of fill in if any gaps, if there's any questions. Like was mentioned, I'm here, I'll speak directly to access to vaccines for non-healthcare veterans, which I'm going to classify under our general population vaccination access. And I'm happy to also take any questions or clarify anything. Again, as this issue changes daily, I want to make sure I'm able to be as flexible as possible and address some of the immediate questions and concerns that you guys might have. So high level, as many of you know, that our access points for vaccinations are at our community healthcare clinics, they're at pharmacies, there are massive drive-through sites, and all of these different points of contact vaccination sites are open to the public. We're collaborating with healthcare clinics, our hospitals. All of these are available for sign up on our vaccinatelacounty.com website, which I can put that link into the chat, but that is our hub for all things vaccine. I know there's been not a day goes by where people aren't communicating challenges with getting a vaccine. Most of those challenges are around reserving an appointment. Over the last few weeks, I know this has gotten easier as some of the kinks in the system have been worked out, but also as there's more appointments have become available. At each site, we have one of the 3 different vaccines available, either Moderna, Pfizer, or Johnson & Johnson. This week was our first week of getting the Johnson & Johnson vaccine, which, as most of you know, is the 1-dose vaccine, which many people have been opting for because it's been 100% effective at preventing hospitalizations and serious illness, and also has, again, it's 1 dose, which makes it easier for targeting our hard to reach areas. Another one coming variable that is something to keep on everybody's radar is the state is getting, and Blue Shield are getting more and more involved with our vaccine rollout process. Their hope is to help counties and cities target hard to reach populations. So reaching out to communities that have mobility challenges or are older or have less access to healthcare. Again, those are the populations that are receiving or are being the most hard hit by the virus. And so it's critical that, we're not going to be past this virus until we ensure that population gets vaccinated. So the simple process, again, for getting a vaccine is going to vaccinatelacounty.com, which again, I'll type that in the chat once this is over, once I finish talking. And on there, it'll lay out all the eligibility questions. So currently eligible is healthcare workers, those 65 and older, and then workers in 3 different sectors. And those sectors are emergency services workers, so that's everywhere from law enforcement to child welfare workers that are still on the front line. Teachers and education staff, so whether you're education staff at a school or a teacher. And the third is food and agricultural workers. These are prioritizations set by the state. We follow the state's prioritizations. So the state has provided more guidance on specifically who qualifies within those. The simple way of thinking about it is if your job requires you to work in person and engage with members of the public, so not just work in person, but be engaging with members of the public. That is the qualification under those 3 categories. So it's a little bit, originally the state had put out guidance saying all essential workers will be able to get vaccinated. They have updated that with this more targeted population. But this, again, the simple way to think about it is if you're forced to engage with members of the public, not just work in person, but be interacting, whether you're going out into a community or you work at a front desk of an open public building where people are coming in, that's in one of these 3 categories, that qualifies you. And then the last category, which will be prioritized next week, so I believe on the 15th it will go live, is those ages 18 to 64 with pre-existing conditions. Now the state has defined those pre-existing conditions. I can also put a link to the state's prioritization website that gets into a bit of the details of these different prioritizations. But the county will be copying that. And again, our hope is that the majority of individuals that end up in the hospital or die from COVID are you're either over 65 or you're under 65 and have pre-existing conditions. So our hope is, even though it's a lot of people, I think by our estimation, nearly 30% of the county has some level of a pre-existing condition. It's a large population, but it's a critical population to target if we're going to, be past the most severe effects of this virus. I think those are that's really what I wanted to drive at, is the specific ways that you can get a vaccine. We're encouraging everybody with means to sign up for our drive-through sites, because those are the most efficient sites, and we want to make sure that these small community health clinics and hospitals are alleviated for local members of the community that have limited access to transportation. But all sites are open to everybody except for some that are specifically set up for teachers or law enforcement. But if you go on our website, it clearly defines where you're able to access the site based off different qualifications. I'm happy to cover anything I didn't, you obviously want to hear from me, or if there's any questions that I can touch on, I'm happy to do so. Either you want to put them in the chat or ask them for, I don't know what the best way is in this Zoom format. But happy to answer any questions on the vaccine front. Do I have the ability to share my screen, by the way? Amy?
Yes, you do. This is Giselle. You do have the ability to share your
Would
screen.
it be helpful if I shared my screen to the vaccinatelAcounty.com page and walked through the
Yeah, definitely.
process? I didn't want to do a PowerPoint because literally the site changes every other day. So I knew whatever I put into a PowerPoint yesterday would probably be updated by today, and didn't want it to be out of date, but just realized there's this screen share option, and that might be helpful.
Yes, and if any of our participants have questions, right now is the best time to ask. We can put it in the chat or use the Q&A option now that we have them here. That's those difficult questions.
So I'll walk through this, and Amy or Giselle, if you see any questions pop up, please just interrupt me and flag them. I'm happy to answer. But this is vaccinatelAcounty.com. This is our main hub for all things vaccine. As you can see, there's big, book an appointment, data on the vaccine distribution, and then any other frequently asked questions over on the left side. Here it says what phase we're currently vaccinating, and this is all phase 1A and 1B, which again, healthcare workers, skilled nursing facilities, and then educators, emergency services, and food and agriculture. Yeah. So again, more info. This will kind of clarify if you're in one of these categories and if you qualify or not, because I know there's been many questions on who qualifies, and I'm asking those questions every single day. And again, as of next week, 18 to 64 with underlying health conditions will also be under here in tier 1 of phase 1B as qualified. So if you get an appointment, come here, click book an appointment. And again, bear with me because this site was literally just overhauled yesterday or the day before. So I'm still figuring out my way through it, but to make an appointment, it's all linear. First, check your eligibility. This is kind of what we'll go through again, what I just kind of talked about. If you think you're a food and agricultural worker, click here, and here's a definition of all different categories of food and agricultural workers, including exceptions of people that do not qualify. And it on some of this information also says what you need to bring, type of vaccine that you need. Again, everybody, because we're still in category everybody 18 and older, it's still going to be Moderna, Pfizer, Johnson & Johnson. It's all the same. It gets different when we get under 18 because there's different. Some of the vaccines have not been tested on children, but currently Moderna, Pfizer, Johnson & Johnson, all are extremely effective. All are interchangeable, and I know there's been conversation about Johnson & Johnson being less effective. It may be on the margins technically from a data perspective, less effective at showing small symptoms, but as far as preventing hospitalization or death, they are all 100% effective. So really trying to push that message that Johnson & Johnson is definitely not a secondary vaccine. It's incredibly effective, and as effective at preventing serious illness as the others. And then finally, look for an appointment. You can look by type of appointment system. Unfortunately, there's still many different systems, which has caused a lot of confusion. There's also locations and a map. So to scroll down, if you want to look for a location near you, click a map, and here's all of our sites in the county. So say you're really geographically specific, this is really helpful, and obviously you can zoom in to a specific area and find one near you. But say you care less about the geography of where your vaccine site is and you just want to find an appointment, the best way to do it would be to go through one of the available appointment systems. So click, for example, myturn.ca.gov, which is the state's appointment website that we're using. You click here and it takes you to My Turn. And here you would go through inputting your information, and then it would pop up and show which appointment sites are available and have time slots available. And there's no system. It's not like new sites are added or new appointments are added every Monday, 8 a.m. or something like that. As new doses become available and as doses are moved around from sites that are experiencing less traffic, doses are reallocated. So it's important to keep checking. And if you go through and there aren't appointments available, you can sign up to receive a notification for when appointments are made available. While I was talking, did any questions pop up while I was talking there?
Yeah, Andrews, you had a couple of questions. One of them was, can you comment on a wait list for extras or expiring vaccines?
So there's two different answers to that question. So if you are qualified and you try to make an appointment, you can go through this My Turn site, and if you got to the page where they said there was no appointments available, it would tell you can sign up to be notified when new appointments become available, and you get an email or a text. For those that are currently not within the qualifications, so say you're under 65 and don't have underlying health conditions, each specific site hosts wait lists because each day is kind of fluid about how many vaccines they're going to have available. So there's not a clear, easy way to do it for those that aren't qualified yet, just because there's still such a very, very high demand for those that are qualified. But each site does keep a wait list for non-qualified individuals that are available and ready to get a vaccine. And I know many people have, it's not a foolproof way to get the vaccine, but I know it has worked for some people.
And then there's another question from Maggie asking, because the homeless population is a high risk, are they currently eligible for the vaccine regardless of age?
Yeah, so we have homeless outreach teams from our Department of Health Services that are going out and vaccinating the homeless community. Shelters were prioritized in congregate living facilities was one of the first prioritizations to get the vaccine. So those were prioritized those were vaccinated very early on. But also we have outreach teams that are going out and vaccinating the homeless population, and those teams are receiving the Johnson & Johnson vaccine, mainly because it's, our return for second doses rate was lower in that population. We want to make sure we get it one shot in, that's all they need, and then they don't need to worry about keeping track or coming back, because we know there is mobility concerns with that population.
And then another question is, what documentation is needed when appearing for the vaccine?
So if you're qualified by age, it's just any sort of formal government ID that shows your age, shows that you're over 65. If you're in the food service industry, you just need to bring a pay stub to show that you work in the food service industry. They went with pay stub because not every restaurant has ID badges, and that seemed to be the most inclusive. For emergency service workers, you need to bring some sort of badge or ID and be able to attest that you are working frontline with members of the public. And then teachers, it is the same thing, a pay stub or some sort of ID badge showing you work in education.
Another question is, do persons who have already had COVID and recovered at home get vaccinated? And when can they get vaccinated after exposure?
So I believe the recommendations, if you have already had COVID, they recommend waiting. I think if you can, they say, if you wait 3 months, you're covered. But I believe they're also still saying you shouldn't not get the vaccine if you are eligible just because you've already had it, because it can still help prevent transmission. And there's no certainty about once you can get it again. So if you're not high risk, it's better to wait. You can wait the 3 months, but if you are in a high risk population, you should get again. Obviously, they say consult your medical provider or your primary care physician, but if that's not an option, it's better to err on the side of getting them out. There's not severe side effects, like significant side effects. There may be some, more agitating symptoms from getting the vaccine if you've already had COVID, but nothing severe. It's not going to hurt you.
And then another question, it's a long one. So myself and my son have had and survived COVID-19 about a year ago. My sister's family had it in early December, all survived. My coworkers had COVID in November, all survived. I have numerous friends, families who are frontline emergency room nurses. They're seeing most deaths among individuals with preconditions. Why is that? Why is there not more conversation about the 99% plus survival rate and almost 100% survival rate among children? Why is there not more discussion about natural means to boost our immune systems like vitamins, etc.? Why do we need a vaccine for a virus with such a high survival rate?
No, that's a good question. I think that's been an ongoing conversation, and one that I know Supervisor Barger has tried to push when we're balancing caution and how cautious people should be and how fearful people should be. And I think that the simple answer is yes, the mortality rate is technically statistically low compared to other past plagues and pandemics that we've had, especially given the fact that while only, I think it's just about 2 million people in LA County have formally tested positive, we expect closer to 40% of the population has already contracted COVID. The tricky thing is that it's incredibly contagious, and that it can very easily and quickly impact those that are more vulnerable to it. I think last I saw, 93% of fatalities have been from those with pre-existing conditions, and 70% are those 65 and older. And how it impacts them can be completely random. And I think that's the concern, is it's very hard to isolate the population that is vulnerable. So while yes, the non-vulnerable population is going to be relatively safe from this, minus some long-term side effects from it that are still being researched, but because it is way more contagious than other viruses we have seen before, it can so easily spread to vulnerable populations, and it is so difficult to isolate and protect them. It's a hard question, though, and it's an important question. I think it's one that we're going to be reflecting on for a long time, and how we respond to viruses like this that have lower mortality but high virality.
Okay, and then we'll take these last two questions. So for those who have a medical condition, what documentation can you use? I know it's hard to obtain a doctor's note.
I need to go back to the state's website, because I think they have not launched that, all of the details on that qualification yet. That's going to be coming out next week. I'm expecting it's going to be some level of medical report history that you've got from a doctor. Obviously, a doctor's note is probably also going to be acceptable. But I believe, and this is where it's going to get challenging, because there's so many different ways to attest to your condition. But I believe you're going to need some sort of clinical, either it's a printout diagnosis from a doctor's office or a formal note from a doctor's office is probably going to be what's expected. But we're still waiting on the state to give more info on exactly what they're going to require.
Okay. And then we'll take this last question. So why do we talk so much death with so much survival? And what about the fallout from our overreaching COVID policies and mandates that themselves lead to increases in mental health issues, as well as suicides or deaths among seniors put into such isolating circumstances when we know such isolation can affect their health?
Yeah, and I think, and on top of that is also that we know that we have not been diagnosing or tracking or identifying other really severe health conditions like cancer, heart disease, et cetera, because people are scared to go to the doctors, they're scared to go to the hospital, or the hospitals have just been unavailable. Supervisor Barger brought in a motion 2 weeks ago to have a formal report back at the board meeting in 2 weeks from now from the Department of Mental Health, really opening this up. They've been researching this very closely, and we really want to get their perspective on the severe mental health impacts on our communities. And it's been a constant message and policy point from Supervisor Barger since the beginning of, we can't just assume people can safely just sit at home. A, there's many that can't, and it's harmful for their health and mental health to do so. But B, even the people that physically can be at home, everyone has experienced social and mental deterioration over the last year. And those are going to be side effects that we're going to be overcoming for years, especially among our children, which has been a massive frustration and fear for Supervisor Barger of what we're going to look at going forward. but it's 100% has not been talked about enough, and it's something we're going to be dealing with and reckoning with for years, and it's really scary.
Okay, thank you so much for that, everyone. That was Anders Corey, the health deputy with the Office of Catherine Barger, who was speaking on COVID vaccinations and the access to it. So thank you so much for taking that time. If there's any other last minute questions, we can take maybe one if someone has a question for Christina from the VPAN or for Mr. Lavelle. Meanwhile, while we're waiting for that, so we do have an announcement for April, the next collaborative coming up in April. So the military families and children will be observing the month of the military child during April's meeting at 11. The group will also be hosting a giveaway April 24th. If you're interested in supporting the giveaway by either handing out bags or including information from your organization, please feel free to email Felicia that you can participate. So she will email out the flyer with sponsors and location information. Okay, and then thank you. And of course, if anyone has any follow-up questions, Corey's provided his email information in the chat box. Thank you for that, Corey.
All right, it doesn't look like there's any additional questions.
All right, perfect. Then thank you all so much for being here, for taking the time. Thank you to our speakers for coming in and giving us some important information. And then, of course, the working group links are listed in the meeting agenda. So thank you all once again. And, you know, happy National Women's History Month. So I know everyone here has some amazing women in their lives. Make sure you thank them for everything that they do.
Thank you, everyone. See you next month.